So I think the Circle offers a great opportunity for patients to get high quality care from their doctors in a fantastic environment. Patients coming to Circle know that they're going to see a consultant and that they get that specialist one-to-one care from the consultant of their choice. They can also be more specific about a particular field. Even within ENT, we subspecialise, so I'm a head and neck surgeon, and so patients know that by coming and seeing me, I've got the expertise in that particular head and neck field. And they know that if they do go on to have surgery as well, that they can have that surgery tailored to their specific needs, and again with a high quality team to provide everything that they should expect from a healthcare service in the 21st century. So we see a huge variety of conditions in the whole of the ENT field. There may be something that lots of patients have heard of, like tonsillitis, which is obviously very common. We see lots of patients with ear problems, but particularly patients will come through to me with conditions related to the throat. So they might have swallowing difficulties, they might have pain on swallowing, they might have problems with the voice box, hoarse voice or laryngitis. They may develop feeling of a lump in their throat. Again, I see patients with problems with their salivary glands, both the parotid glands, which lie in front of the ear, submandibular glands, which are underneath here, as well as the thyroid as well. So the thyroid is a gland that lies in the front of the neck. Part of the Bath ENT specialist group is made up of currently 5 consultants. We're all ENT surgeons, but we all have subspecialist interests. If you're referred through to us, you will be directed towards each of us depending on our specialist interest. So for example, if you have an ear condition, you may go to one of my colleagues, but if a head and neck specific problem, you'll come to myself. At least, again, that way we know that patients are getting the correct care tailored to them. I think a very common condition that we see is something that's called globus pharyngeus. Now this is a condition that patients experience fairly commonly, and classically it describes as a feeling of something in their throat, like something's got stuck or that there's something that's there. It's very common, slightly more common in ladies than men, and we think it's due to the muscles at the back of the throat going into spasm, but it can be quite a worrying condition for patients. Lots of patients are really quite anxious about it, and obviously some of those patients will be maybe worrying that they may have a condition like cancer. We see lots of patients with regards to this condition, and when they come and see us, we will both take a history, because that gives us a very good idea of the nature of the condition, but we'll then also go on to examine them in the clinic. That examination would involve a thorough examination of the neck, also of the mouth, and then finally we do an examination of the inside of the throat using something called a nasendoscope. Now this is a very long, fine camera that actually passes down through the nose, and it means that we can thoroughly examine the back of the throat. It sounds quite scary and lots of patients are worried about it, but actually it's a very simple procedure and most patients find it really not that uncomfortable at all. But it does give us the great ability to look at the back of the throat in great detail and ensure that everything's normal and reassure patients. So that treatment can be on a number of different levels depending on how bad the patient's symptoms are. Very often reassurance is enough to relieve a lot of the anxiety related to the condition. But occasionally patients have problems associated with acid reflux that can cause problems in the back of the throat. And again, that can be diagnosed often by looking at the area with a camera. And therefore there are some medical treatments that we can be put into plan afterwards if needed. These patients occasionally will need to go to the operating theatre to be examined, but that's fairly unusual. Yeah, so often globus pharyngeus will just get better on its own, and the reassurance from the examination will often mean that patients don't have any problems in the future. The main focus of my job is focused around the care of patients who have head and neck conditions, but particularly cancer of the head and neck. Head and neck cancer is quite problematic for patients, caused by the quite debilitating side effects that they can have. These problems can affect their voice or their swallow. I'm the clinical lead for ENT, but I'm also the cancer lead at the Royal United Hospital. I'm also the clinical director of the head and neck division down at the Royal United Hospital as well. And as I say, my main focus is on the head and neck cancer patients, both diagnostic for the diagnosis of the cancer, for their treatment, and also the long-term follow-up for our patients. We don't treat patients with cancer directly at the Circle, but we see patients for their initial assessment and diagnosis at the Circle. If the diagnosis of cancer is made, those patients will be transferred to the Royal United Hospital. It's been that passion for head and neck cancer particularly that's always driven me forward to make sure that we provide the best care for our patients in the area. I've grown up locally, so I have a lot of affiliation to the area. I want to make sure that the people of Bath and the surrounding areas get the best quality care.